thank you for having me. I'm going to walk you through today. The title of my presentation is Innovations in Cultivating Talent and Standardizing Clinical Onboarding. So here's the agenda. We're going to talk about some workforce data in both just healthcare workforce as well as nursing and health sciences programs. We're going to discuss innovations in cultivating talent, standardizing clinical onboarding, and some of our MHA workforce training programs. So starting with our workforce data, as was mentioned earlier, this is what things have looked like as we've came out of the pandemic. So each year, MHA surveys hospitals on about 34-ish occupations on the turnover and vacancy rates. So we've got a plethora of years of data. This is kind of a 5-year look back to 2019. And as you can see, as we expect during the pandemic, the turnover and vacancy went up, and you can see that reflected there in the 2021 numbers to kind of our high point. And then things have gotten better, so turnover and vacancy has decreased. But in most cases, in most occupations, like you see here, we're not back to where we were pre-pandemic. So things have eased slightly, but we are nowhere out of the woods. This slide is showing you, these are the top 10 hospital professions with the highest employee vacancy and the highest employee turnover. And when I go out and present on these slides, I like to showcase that, as you can see, especially in the vacancy, because that's where I'm concerned about a lot of the times, those positions that are in demand and they sit open, unfilled. You know, many of these positions require a 2-year degree or less, a certification, an associate's degree. Some are on-the-job training. And so that's what, especially when we talk to students, we talk about how you can get into healthcare careers with little or no education, debt, etc. And these are great careers that are high in demand with good paying salaries and benefits. So here I just thought I would do a call out and we'd look at registered nurse. So when we say staff registered nurse, this means those nurses at the bedside. So in hospitals we have many nurses in leadership and other type office positions, but this is really looking at those that are providing care at the bedside. And again, you can see that trend, as we mentioned earlier, an increase during the pandemic. Things have gotten better since then, but we're still not where we were pre-pandemic when it comes to turnover and vacancies. So this is just kind of a map that shows you the turnover and vacancy in the different regions of the state for the RN position. And the darker is kind of the more increased turnover and vacancy. The lighter colors have a little less turnover and vacancy. And so just you can see some high pockets, especially with the vacancy in the northeast and the southeast parts of the state. Earlier we were having kind of some conversations around rural. We've got a lot of very rural areas in those a lot of rural areas in those regions. And the same over here when we look at South Central and their high turnover numbers. Okay, so every other year we give our CEOs a survey to just kind of check their polls, see if they're happy with the Missouri Hospital Association, what are things we can work on, improve on, etc. So this is one of the main questions that we ask. In order of importance, what are the most challenging issues your organization is currently facing? And we just did this, they just filled out this survey in May of this year. So this is the word cloud. So the words that are the largest are the most important, and they rank them the highest. So challenge number 1, you can see I highlighted staffing and workforce. Challenge 2, here we go again. Staffing, workforce, and shortage popped up. And then number 3, still staffing and shortage. So this is the item that we say, you know, what's keeping our CEOs up at night? It's workforce, staffing, shortage, etc. So workforce problem statement. We talked about all of these things earlier. Our age demographics, a tight labor market, certifications and training required, limited exposure to healthcare careers, students not enrolling in healthcare programs at the rates that we need in the field, along with retention and other things. But for this audience, these are the things that we're going to focus on today. And so our conclusion is that healthcare organizations and hospitals need to work better together to help raise awareness, build interest, and remove those barriers that we talked about in healthcare careers. So what are we going to do about that? What did MHA do about that? We decided A few years ago, many of you that are here were at this event, but we had a metropolitan in both St. Louis and Kansas City executive workforce roundtable, where we brought schools and education to the table to brainstorm. How can we work better together to solve the problems? And out of that, we ended up creating 3 task forces in both metro areas, an academic practice partnership task force, a recruitment task force, and a clinical onboarding task force. So one of the things that kind of kicked everything off is we worked with our academic practice partnership task force to create an enrollment survey, is what we called it. And it was completed in both metros. We surveyed 15 key positions that were selected by our HR and recruiters from our hospitals. The questions were selected by the academic partners at the tables, and it analyzed capacity, enrollment, graduations, et cetera. And overall, we found that it showed a lack of awareness, interest, and enrollment in some of our critical healthcare careers. And we're going to look at just a few of the survey results. So Kansas City, we'll start with them. And again, I'm not going to go into super depth with all this, but you can see the trend here in nursing. So looking at this is the 2024 capacity, and this is the 2024 predicted graduations. Again, here's our 2025 capacity, 2025 predicted graduations. So overall, hospitals were saying we're not filling seats. Now, I have heard for fall enrollment, things have looked better. I've kind of heard that across the board. The enrollment this fall in nursing and allied nursing and health science programs have been better than they were in 22, 23, et cetera. Again, and then here looking at AD in nursing, a little better. You can see accelerated, bridge, LPN, RN. Here's the LPN program, nurse assistant, huge gaps in nurse assistant, medical assistant, CMA. We also went into surge tech, sterile processing, neurodiagnostic tests, and medical lab tech. Radiology, again, that's one I'm starting to hear needs in radiology, especially when it comes to specialties, so those specialty imaging positions. Our hospitals in many areas are starting to have to hire agency for radiology and imaging specialty roles, respiratory therapy, and then the last one's sonography. Okay. So we also asked, what's the reason for unfilled seats? Responses primarily showed application shortage and lack of qualified applicants. Withdrawal reasons, personal, academic rigor, financial, some of those things we've talked about this morning. Student assisted needed, that tuition, equipment, mental health issues, college preparedness, we're hearing a lot about that, personal resources, et cetera. And then looking at St. Louis, I will say on the nursing associates, so we didn't realize somehow Kim was sending in St. Louis Community College information on the ADN program, and it wasn't coming through for some reason. So I just got it yesterday, and I did not get it in time to put it in this presentation today. But it will probably still fall out somewhat similar, I'm assuming. But again, you can look at our bachelor's as an example, capacity, predicted graduations, 2025 capacity, and predicted graduations. Again, we're predicting we're not going to be filling our seats. This slide, we've got LPN, MA, nurse assistant, huge gaps there, medication aid, respiratory therapy, continued gaps, radiology tech, not looking too bad, med lab, surge tech, sterile processing, EMT, you can kind of see those. And again, they're the metropolitan areas, but probably a good kind of overall picture of what's happening across the state. Unfilled seats, again, very similar reasons, lack of qualified applicants and applicant shortage, number 1 and number 2. Withdrawal reasons, personal, academic rigor, again, very similar. Student assistance, many of the top 3 or 4 were the same, just in a little bit different order. With college preparedness, financial barriers, childcare popped up here in St. Louis a lot higher than it was in Kansas City, mental health issues, personal resources, et cetera. So with the survey results, what we did is we asked the hospital partners, for them to use it when looking at strategic recruitment opportunities, engage with the hiring manager, because a lot of times the hiring managers, especially when it comes to clinical sites, do not realize the issues that we're facing, that they have got to find ways to open up more clinical sites so we can get students into these programs and into rotations. Informing the executive team as well and addressing those gaps in talent supply. And then for our educational partners, just using this data to align programs with hospital demand and enhancing student supports, working with the school to find out maybe if there's ways together you can enhance supports for students and help better prepare them for these programs. So innovations in cultivating talent. So we've done a lot so coming out of this workforce summit and these task forces have done a lot of work that I'm gonna kind of showcase and share with you. And so kind of what has been a good model for us at MHA over the years with different programs we've had is we tend to have success in incubating ideas in Kansas City, replicating them in St. Louis, and then pushing them out to the rest of the state. And this is what we're looking to do and have started to do with these programs I'm gonna talk about. So first, it's just the student pathway, trying to get everyone to think about it a little bit different. In the past, it was always, create awareness and an interest. They're gonna enroll in a program, then they're gonna get experiences through clinical experiences, et cetera, and then develop them as an employee. But, we need to start thinking about where can we take these experiences and bring them further sooner in their kind of career exploration and deciding what they want to be, what they want to do, what do they want to go to school for. So we've kind of done that through a few different ways. One is a program we started called Fast Track Your Future in Healthcare. And this is a high school hiring event. And so it targets juniors and seniors. And we asked for employers, education partners, and workforce funders like the RUNG or the Full Employment Council or SLATE that was mentioned today. And the goal is to connect students to a job, number one. But number two is showcase. We asked all of these exhibitors to provide and showcase how a student can get into a healthcare career with low debt or no debt. So whether it's an apprenticeship, an internship, tuition reimbursement, scholarships, whatever it might be. Making that a focus. So we have done this event twice in Kansas City, once in St. Louis. So the first year in Kansas City, we had about 100 students. The second year, we had 200. St. Louis, we just did it for the first time this spring, so we had about 150 students. And the feedback was great. So some did get jobs. We actually had some here in St. Louis. We did it on a Saturday, and we had 2 parents get jobs that came with their students. So that was really interesting. But yeah, so great events that, again, if there's an interest in this in your region of the state, I'd love to have a conversation. The next one is the Hidden Careers in Healthcare Teacher Externship. And this one targets teachers in not just healthcare or science fields, but in all fields. And the program really typically is a half a day of information around various careers in healthcare. So typically, I come in and set the stage with the healthcare workforce landscape, and then we have speakers from our hospitals come and talk about their kind of hidden career, those unknown careers in healthcare. And we try to pick an employee from a hospital too that kind of got in the door entry level, worked their way up through training, education, and was supported along the path. And then we have a breakout with the teachers where they get into groups and they talk about what they learned throughout the morning and then how they're going to use it in the classroom. And then they report out to the other teachers about what their ideas are for using it in the classroom. And then they have, to this event, they have signed up for a 2-hour job shadow. So we asked the hospitals, what are the careers that you would like to showcase to these teachers? And we see both middle school and high school teachers attend this. So the hospitals really choose the career, and then when the teachers register, they're able to order which careers they want to see. And so then they have a 2-hour job shadow in the afternoon at that hospital. And so it's been really great experiences, and to see, we've got a lot of great feedback from the teachers, as you can see here. And even those that one guy did building and trades for a CTE program. He was the instructor. And he went and saw the HVAC and the whole that whole facility in a hospital and was just amazed and blown away and was so excited to tell his students about just all that is involved in keeping the heating and cooling and all of that set in a hospital setting. So again, it's been a great event. It continues to grow. Kansas City, we're actually doing this on Monday is our 2024 event, and so far we have, last count, we had 33 teachers in 19 schools, and of course St. Louis there as well. But lots of great feedback for the teachers, and we hope to keep this an annual event. And again, if there's an interest of any of you to talk more about this, I know we've worked, State Fair Community College has partnered with DESE and others, and I've been to their event and spoke, but we'd be happy to coordinate something like this with you as well. And then the third event is Explore Your Future in Healthcare. So this is just what it says, a career exploration event. Our target is middle school and high school students. We did this once in Kansas City, which will be on this next slide, but it's a series of interactive booths. So we invite exhibitors, again, healthcare institutions, schools of nursing and allied health, and then also those support organizations. But everyone has to have an interactive booth. So this was an awesome event, and it's really just to raise that awareness. It's not a hiring event at all. It's just to explore careers. And we had over 50 exhibit booths and over 500 students attend this event. And I love this little data point here. So students did a survey, and out of 500 students, we had 156 students actually completed the survey afterwards to tell about their experience, which I think that kind of says something in itself. But it said, do you have more or less interest in exploring opportunities in healthcare? And 93.75 said more. So I had the opportunity to work the exit booth. So they had, as you can see, a little badge, and as they went to booths, they got stickers. Well, at the end, they showed me their stickers, and they got a bag of goodies that told them about different healthcare careers and all the things. And so I would continue to ask the students, like, what was your favorite table? Or, is there a career you're thinking about now? And they were just saying everything across the board: security, sonography, medical lab tech. And I knew when they walked in that door, they had never even heard of those jobs at all. So to hear those words come out of their mouth was just like, oh, it was like this fill in my cup moment. So again, something that we're wanting to replicate to help hospitals and schools come together so we can build that interest and awareness for our students. So this is something really cool that we're working on as well, the high school access pilot. So we have a partnership that we've formed with the Kauffman Foundation in Kansas City, and they have a goal, and I'm not gonna say the numbers right, but a goal to get like every high school student a real world learning experience before they graduate high school. And so when it comes to healthcare, they're obviously kind of starting to face some of these barriers and challenges that we've talked about today in getting even those job shadow opportunities, because we are requiring things like a flu shot, or maybe some are requiring a background check, or hand washing, HIPAA training, all these different things that are required for a student to job shadow. So they came to us and we talked about what can we do to solve this problem? So again, we brought together a group. In this instance, the group is made up primarily of hospitals, but then we've also got some CTE program advisors and the Missouri HOSA and DESE individuals. Shelley Waymeyer is one, if you've heard of her, but helping us put this thing together. And so we are working on a system that well, actually, let me step back a minute. So we brought hospitals together. We have 9 hospitals in this pilot program, and have worked with them over the past several months to standardize what they require for, 1, a job shadow, which is just like an eyes only, and 2, maybe a more hands-on or long-term pathway. Maybe they're students in a CAPS program, or something where they're going to be routinely coming back to the healthcare system. And we have brought these 9 hospitals together to standardize what they're going to require for HIPAA, background checks, flu, hand washing training, and all of those things. So we're at the point where they have agreed on what those are going to be. Those have been vetted by legal teams, et cetera. And we have a software system where students will go in. Some of it's online training. Some of it is things that the teacher in the school, and primarily this will probably start in CTE programs, and those students that are in a health OC type of or other type of health program in the high school. But that instructor will be able to check off on the competencies of these students. So as these competencies are checked off, students will receive a digital badge all the way through the process, and at the end, we, as a certifying body, will certify that they have completed everything that they need to do to walk in a door at a hospital in this pilot program currently to do a job shadow, observation, whatever it might be. So trying to create a streamlined pathway for high school students to, again, continue to build that interest and awareness in healthcare careers. So we hope to kick the pilot off. I think right now we're signing contracts and all of those things, and that we hope the pilot will go live January, so at the start of the spring semester for school. So again, just trying to figure out ways to, even at the high school level, get these students in the door, knock down some of these barriers and challenges that both the schools and the students are facing in trying to get that interest in a healthcare career. Okay. And again, if this is all successful, our goal is we're working with the Kansas Hospital Association on this too, because in Kansas City, we got to do everything with Kansas because we're on both sides of the state. And we both hope that this program will grow to where it could be statewide in all schools in Missouri and all hospitals in Missouri and Kansas. A nursing portal, this is another kind of brainchild idea that we're working on. So many of you have heard of Nursing CAS, probably. And that's a kind of nursing application portal. But it costs a lot of money. We're hearing it's somewhat not effective. And so our hospitals, more on this one, our schools of nursing and health sciences in Kansas City have said, hey, is there a way to create something for them that's Kansas City specific, which again, everything starts out Kansas City specific, and then we grow it to the rest of the state. But where students can see, we want them to see that we have, we've got maybe KU over here has a waiting list of 75, but we've got openings of 10 seats at our school, and these students aren't even realizing it. So we're having these unfilled seats across the Kansas City region while other schools have wait lists, but there's not one place students can go to see, hey, I can't get in here, but I could get in here, here, and here. And so we kind of liken this to like a sports, like a college transfer portal or sorority bid process. But we're looking to create a website, so we're working on an RFP now, where colleges can enter their information. So, what all your requirements are to get into the program. Information about the program would be out there. The thing that would be most non-static and that would be something you'd have to change is what are your available seats? And so colleges would have a login where they could go in and update their available seats. And then also in this program, as students come into the website, they are prompted to create a login. That login then they can kind of designate, we don't know how this is going to play out yet with how it's set up, but they can show an interest in a school, and it will email a designated recruiter, whomever that might be from the school, so they can then contact the student. So just trying to make it easy for students to see what all nursing and health science programs are available across the state, who has openings, what the different requirements are, and then a way for the schools to be able to connect with the students easy where they can reach out and work back and forth and talk from there. So again, something that's just in the works. So to be continued on that. I also just want to remind everybody we have our Missouri Health Careers website where students and adults can go out here, learn about careers in healthcare, and link to both training programs and to jobs. You can order our career guides for students. These are great for any of you in the room, and especially those in like college admissions, trying to help students figure out what they want to do. It's a spiral-bound book. Actually, I put some in the back where students can go online, students can look at the book and see different information about the various healthcare careers. And then lastly is our save the date for our virtual healthcare career day. So we have began planning that. Hospitals were notified 2 days ago of their selected occupation, and if they were kind of in to participate in this day. We had 17 hospitals showing interest, and we could only choose 8 to participate just on time constraints. But if you don't know what this day is, we partner with the Missouri Chamber of Commerce and the Missouri Department of Elementary and Secondary Education to put on a one-day event where we are virtually showcasing careers in healthcare. So 8 hospitals we kind of lay out some occupations, and then they choose those occupations that they want to showcase as well. So we come together and they have a 20-minute segment on this day in February where for the first 10 minutes they show a pre-recorded video of their employees doing that designated career and career pathway. So we like it to be action-oriented, showing what these individuals are doing in their daily jobs, but then also talking about their path. How did they get to where they're at today regarding school, work, etc. And then the second 10 minutes of their 20-minute segment, they're live on Zoom talking to students. So we crazily negotiate students and schools coming into Zoom Live asking these employees questions about careers in healthcare. So it's a really great day. So for those of you that are schools, there are also sponsorship opportunities. So if you're interested in that, there's sponsorships from just having your logo to actually having almost a 2-minute kind of commercial blurb or a video you want to show kind of during the breaks. And there's also an opportunity to speak for a few minutes. We've had Jefferson College and some others do that in the past. And then lastly, I wanted to talk about standardizing clinical onboarding. So back in, well, actually I put the date, November of 2022, the Missouri Association of Colleges of Nursing came to MHA and had a request, well, I don't know if it's a request, I guess, for us to look into the issue that schools were facing around the clinical onboarding process. So students, you know, as you all know very well, doing clinicals at multiple sites, we're having to take multiple trainings, the same training, maybe HIPAA training 3 times for 3 different clinical sites. Some were even going and getting their flu shot multiple times or a vaccination. Multiple background checks were happening. And all of our hospitals were requiring all this different compliance documentation. So it was not only a burden on the student, but it was also a burden on the faculty at the school, having to track. I mean, I'm hearing about people hiring 1 or 2 FTEs just to track all this compliance that's required. So we said, yes, we'll look into it. And we, again, back to the metros, because this had came up in all of these conversations. So we went back to the metros and formed a task force. And so kind of our problem statement is kind of like I just said. I guess I talked to my own next slide. But we have these regulatory requirements that hospitals do have to meet. And they have to be done before these, before they attend their clinicals. But again, it's many, many hours of documentation, multiple times a year. It creates a significant administrative burden. And so this project of what we're thinking would improve the onboarding process by saving time and resources. So our goal was to standardize some of the education for the students, ease the maintaining of the materials, reduce student education, redundancy in the education that they're doing, improve efficiencies, et cetera, help with record keeping, and hospitals still staying compliant because we do have the Joint Commission and others that we have to adhere to. And so we started this effort in Kansas City. And I put the participants up on this particular task group because I wanted you to see how involved both the hospitals and the schools are. So we have a huge representation of very committed professionals that continue to meet virtually and in person, almost in person more because they like it so much, that meet and talk about these types of things. So phase 1, so we kind of started with Kansas City because they already had a consortium called MOCAN. And with this MOCAN consortium, they had many, many years ago standardized their clinical onboarding curriculum, and they also have a standard software system. They actually hired a developer that created a system called Clinical Student that they still use today. And that is where all the record keeping goes for students. That's where students are assigned tasks to do. That's where they schedule clinicals. Everything happens in this system. But we had heard even from some of the individuals in MOCAN that, especially after the pandemic, a lot of turnover. There were new people in these roles. Maybe what had been done in the past hadn't been carried over. People were starting to kind of stray from the onboarding requirements and just adding to it and adding to it and adding to it. And that's definitely not what we wanted. So we brought this group back together and said, hey, we need to, let's kind of like get back together and reevaluate what you've been doing. So we've been doing that. That's, for that group's probably been about a year and a half. But we went all the way back through all of their background and occupational health requirements. We reviewed the current manual. We've made adjustments and actually narrowed it even down to, we got rid of some multiple pages and condensed it for the student. And so we've been working through that, and we've kind of got all of that done. And now we're working with Clinical Student, which is the technology that they use in Kansas City, to just, again, try to streamline, make things more efficient there. So phase 2 of this work will begin October 29th. What phase 2 will be focusing a little bit more on technology. So we'll be reviewing the need and the cost to take this. There's, I think, is a 106-page clinical onboarding manual to an electronic version. So right now it's in the clinical system, but it's as a PDF, and then students go to another place in Clinical Student and they take I think it's a 65-question test over the manual. So then once they've taken that test, that's how they solidify that. But so we're going to talk about that. Is it cost benefit to the students, the hospitals, the schools, to try to make it more of an LMS type of situation where it's a little more interactive and whatnot? Again, may or may not be. And then just continuing to look for those additional ways that we can streamline the process. So here's the St. Louis participants. You can see, again, just a real great team. This team's funny. They started meeting virtually, and eventually I was kind of like, you guys, I think we just need to get together in person because we need to get things done, and it's not happening here virtually like I want it to. And we had a virtual meeting back in, I don't even know, April, and every month since then, or I'm sorry, in person back in like April, and ever since then they've been in person because they love it. So they've loved meeting in person, and both of these groups, like, we end a meeting and they continue to network for another like half an hour after the meeting's over. So it's been great and really solidified and increased some partnerships there. But again, great groups meeting there. So in St. Louis, kind of what we've been working on, this group's been meeting for probably a little over, or not quite a year, probably, yeah, not quite a year, but same process. So we're starting from scratch here, though. They had nothing in place. So we brought all the hospitals and schools together. We have reviewed all. Is anybody here on any of these committees? Right here, yeah, say it. Okay, so we've reviewed. So feel free to jump in and help me here. So we've reviewed the background and occupational health requirements. We've pretty much agreed on standard background and occupational health requirements. Last meeting, we had a few tweaks with that, just with wording. We're making sure everybody's all on the same page. So we had all the hospitals pull together their education training requirements and modules or policies for that. So primarily the three bigs plus St. Luke's kind of brought all their policies, and we put them into one, and we've kind of been combing through all of that. What's duplicative, what needs to stay, what needs to go. So we're still kind of finalizing that process. We've got a big meeting on the 25th. I think we're meeting for like 4 hours just to try to get through all the rest of this. And then, so we're in the process of trying to standardize that, and like I said, we'll meet in October 25th. So then our next phase will be phase 2, will be that, again, that technology option. So researching, what everyone's using. So it's interesting, in Kansas City, they're primarily using Clinical Student. In St. Louis, primarily My Clinical Exchange, but also some others are mixed in, would you guys say, that are on the committees? So we're going to talk through what all the different technology people are using. Is there an opportunity to standardize that? Is there an opportunity to maybe look at what Kansas City's doing too? And is that a technology that we can utilize? And then also this group asked, they have some additional onboarding needs they would like to talk about, like scope of practice. And so once we kind of get through some of this clinical onboarding, we're going to move into just what's the next thing that they want to work on to try to streamline in this process. So again, just something that we're trying to finalize in Kansas City, refine in St. Louis. There'll be some time where we compare what Kansas City and St. Louis are doing to see if we can possibly get the two on the same page, and then potentially expand this to statewide. And that would be, again, in both Missouri and Kansas, because we are working with Kansas City. Just a reminder of some of the other programs that we have at MHA, our Preceptor Academy. So that's for any employee in our hospital in nursing or healthcare profession. So across the gamut, we even have people in dietary and EVS and whatnot attend this program. But we do have this program, and it really teaches someone how to be a coach, a mentor, and help a new employee, either new to the organization, maybe just new to the department, on board. And that's one of our recruitment or one of our retention strategies, so helping them with that onboarding process. And actually here we have 7 classes. We ended up the year with 11 classes because there was such a high demand. We added 4 more classes to this. So again, a great program that we have. And then we also have our Clinical Faculty Academy, which many of you know of, and that's for really when I tell people that aren't in the industry, it's like, well, it's teaching nurses how to teach at the bedside. That's a really simple way of putting it, but this continues to be a great, great program. We do have a virtual option coming up in December, which is not on here. That's probably what I should have put on here, but we have a virtual option coming in December. And then we'll have 2 in-person in January, so before the semester starts, just right after the first of the year. We'll usually hold one in St. Louis and one in Kansas City, in-person in January, plus the virtual in December. So again, great opportunity for you to send through anyone who would like we have people go through for refreshers, we have people that are new to teaching, attend this program. And then another new thing that I'm working on is an idea to have an academic practice partnership focused summit. And the idea is that we would invite hospital HR, chief nursing officers, clinical educators, and schools of nursing and allied health professionals across all of Kansas and Missouri to meet in Kansas City. We're looking at fall of 2025. And would love your feedback. We're thinking of like a day and a half, so maybe a Thursday, start at 10 p.m. so people can drive in. Some can drive in the morning, going till 4, 5, having a social event, and then in the morning, starting early at like 7:30 or 8, being done by 11 so you can get home. But what we see with this is, showcasing where we are with some of the work that we've been doing that I've talked about today, having a national speaker come in and talk about data, and doing a forecast, showing us kind of what forecast looks like for nursing and health sciences professions, having student panels, kind of like you're gonna have today, having new grad panels. We had a new grad panel at a conference that we held last year, and it was exceptional to hear what these new grads were saying from their transition to school to work. And then also but the majority of the sessions being hospitals and schools sharing their best practices. So how are they working together to address these barriers, these challenges, clinical faculty, like all of the things, and being able to showcase kind of what's happening in the state, and you guys all learning from each other and continuing to form those partnerships. And so thinking about that as well. We've got a RFP getting ready to go out to hotels and venues the next week. So we do see lots of transition into health sciences, and actually when we talk to groups in both the metros that have heard about this work, we have health sciences programs are chomping at the bit to get on board here too. But we've got to start somewhere, and so we're starting with nursing. So if we can get everything kind of worked out with nursing, then we're going to start adding on the other health sciences programs. So that is our goal. So like when I say, let's say, for example, nursing portal is what I'm calling it now. What it really might be called is a health sciences, Missouri Health Science Portal or something. So to make it more all-inclusive, because we know we're going to start with nursing, but then we're going to continue to expand it to other roles.
Well, listen, thank you very much, Jill.
Yeah.
I can't believe all the work that you're doing. I mean, that is outstanding.
Thank you.
Even one of those projects is pretty much a full task. So I'm very impressed. I think it's nice to know as a dean and as a person who leads educational programs that all of these activities are going on to encourage more people to come into the profession. We really need a new generation of healthcare workers to come in and replenish the folks that are retiring.
I will say too something that just as you were thinking of that made me think to the group. So at MHA we just hired a new director of communications, and so as I'm talking to her about these different programs and things, and she's like, why are you like so deep into the education field, and I'm just like, because we have to be, like that's who we are, like I kind of feel like, yes, we represent the hospitals and the hospital association, but someone needs to also represent the nursing and health sciences programs. And the board of nursing are in a spot where they can't, they don't have both sides of the coin, and they're not able to kind of do that as well as someone like us, who we do have the agility to work with both hospitals and education. So sorry we're getting in your business, but I think it's going to be great.
Yeah, we want you in our business.
Yeah,
We need you in our
Yeah.
business. But one of the other things that I would like to ask you, because I just don't know, but how involved or how connected is the Missouri Hospital Association to some of these accrediting bodies that we have to deal with in these various programs? Because some of these standards have been developed over time,
Right.
and as a long-term educator, many of the folks that I know that were instructing or leading these programs came in with lesser degrees and then were given an opportunity to develop their education to meet the standards as they changed. But in a field where, with nursing, they have nice pathways. They have the associate, the bachelor's, the master's in education, nurse practitioner.
Yeah.
But in radiology, the focus is really there on getting your associate's degree and then getting certificates in these other areas to advance if you want to stay within the field. But when you're looking for someone to become an educator in that profession, they want them to have a minimum of a bachelor's
Yeah.
degree, and then and they're very small. Usually, there's a coordinator and a director. And if the director retires, you have to find someone with a master's degree and multiple years of teaching and all the other things that are required. And the market for educators is tight, as Jordan said earlier. It's getting harder and harder to attract people into education.
Yeah.
And especially given that they can make the type of money and have the job that they want with less education in a specific degree format. So do you have any connection with these accrediting bodies to look at ways that they could be a little more flexible in allowing people to come in maybe with a bachelor's degree and then develop that master's degree over a period of time? One of the areas that we really struggled with last year, or maybe it was the year before, in the dental hygiene program, they required a bachelor's degree for students to be trained by them in the clinic. And, if we put something like that in place for radiology, it would eliminate most of the clinical sites that we have at the hospitals, because most of the folks that have bachelor's or master's are in administration or in a higher level position.
Right.
So I just wonder how, the hospital association, because accreditation and regulations do restrict and create obstacles. We don't want to reduce the standards, but we do have to look at the times. I mean, I think in nursing, there was a move back in 2010 to move the profession to the bachelor's degree by 2020.
Right.
And I've seen it in radiology multiple times. But the reality is that getting enough people to do that and move and get that degree requirement in a time like we have now, where we have an aging population and an aging workforce, is almost an impossible task. So.
Yeah, that's a tough question. I would say we have better, or I don't know if better is the right word, we have more relationships with the nursing accrediting bodies, the AACN, CCNE, because we have worked with them through our Clinical Faculty Academy over the years. They've not, I don't want to use the wrong words, but they've not always been a fan of our Clinical Faculty Academy waiver, which is now permanent regulation here in the state of Missouri, where those nurses that do have their bachelor's, they're working on their master's, can attend our 2-day academy and go ahead and teach. So we've kind of had to work with them through the years on that, and we always try to include, the site supervisors. We have lots of people in our education field that are, site supervisors or whatnot, not supervisors, site visitors, yes, for those accrediting bodies. So we usually always try to use them and help us kind of plead our case for various things, and most recently was the BSN program. So we're in that same vein, as we came out of the pandemic, we had hospitals saying, we've got these great 20-year nurses that could be clinical adjunct faculty, but they're not going to go on to school to get their master's. So we've been running this pilot program with the State Board of Nursing that now, if you have your bachelor's degree and you meet a few requirements, like the last 3 years performance reviews have been, above average, you've worked in that specific clinical setting for, I think it's 5 years, 3 years, and then et cetera. So there's a few requirements they have to meet, and then attend our 2-day Clinical Faculty Academy, and then they can teach. Again, that was something that we've had to work through those accrediting bodies with. I will say with those two, and I haven't talked to either one in a couple years, so things might have changed, but there's kind of some old school ways, and they're kind of stuck in their ways to some degree, where I say our Board of Nursing is very innovative, so I'm really glad that we have their support on most of the things that we're trying to do. But as far as those other regulatory bodies, especially when you think about radiology or respiratory therapy, something where with nurses they can be paid for their clinical hours. Well, radiology is not gonna, they don't allow that, and so we don't have as good of relationships with those other professions, or haven't just had the need to work with them as much. But I think the more that your groups, just like the Missouri Association of Colleges of Nursing came to us with the clinical onboarding issue, I think those groups that you all are in, whether it's MOADN or whatever, if you can collectively come to us with an issue, those are things that we can look into on your behalf. So things that we can even take to a national, have the ability to take to a national level as well. So I would just encourage that, formally as a group, if there are things that you would like us to look into, to come together and address it with us in a formal way.
Yeah, I think that would be appreciated. I think that's something, we're pocketed.
Yeah.
And there's so many different accrediting bodies, but if we could look at it in a collective sense, kind of like you're doing with clinical onboarding.
Right.
And then, the issue that you brought up earlier about having students to do shadowing, people keep coming to us asking us if we can set things up like that, but it's become very difficult to get someone who doesn't do all of those things that you mentioned into a hospital setting.
Yep.
So those are real obstacles, but I appreciate that the Missouri Hospital Association is looking into that. The last question that I have for you is that, in healthcare in general, the model has always been that the student or the person that's interested in the profession will go through a program, pay for their education, and then come out into the marketplace. Are there any thoughts or ideas that we can take from other industries that are struggling to find workers, where they're doing things differently, where they may be, funding a student through a program or building that student as they go? If you look back at the history of healthcare, before there were community college programs and university programs, hospitals trained their own people.
Right.
They'd bring them in and they'd pay them and they'd educate them and then expect them to, take a job there at that hospital. Is there anything like that we could take from other industries right now, that we could change the model to encourage more students that see it as unaffordable to come into the healthcare field?
Nothing particular comes to mind that's different than what many of us are already doing. Using the state and federal loan repayment or student loan programs. Again, the apprenticeships, scholarships, tuition reimbursement. We do have a few hospitals that they pay the entire tuition for someone, for an individual that, getting into nursing school or while they're going through nursing school, with a commitment typically on the back end of that, but paying their way. Trying to think of others, just working around different ways with stipends, because they can't pay for clinical hours, so maybe they're able to get them a stipend. So I don't know, nothing offhand that I have seen that it's been like an aha moment of, oh my gosh, this is great, this is innovative, we need to be doing it in healthcare.
I like the idea of the portal, because one of the issues that we have in high demand programs is if someone does get their associate's degree or they complete all their prerequisites in high school, they can't graduate from high school and wait 2 years to get into a program.
Right.
Most parents don't want, their graduates to come out and stagger for 2 years to wait to get into a program. So having a way to identify where the next opportunity might be, or an opportunity where you could accelerate yourself right into the program, I think that could be very beneficial. Geographically, it could be challenging, but if you have programs that are doing didactic online and then the clinical is set up in your area where you live, I could see that working out real well for some students.
Oh yeah, and Amy Ackerson from the state board and I were talking last week about data, the education data that they collect, and versus what we've collected just in the metro areas, and like how we can come together on that and collect good data that we can use to inform these issues. We need probably better data than what we currently have to be able to go to advocate, to go for funding, to create programs, to tell our story at a national level, we've got to have the data. And so that's really important. And we're trying to figure out how we can work together better there too.
All right. Any other questions for Jill? All right. I want to thank you, Jill, for
Yep.
coming today and presenting.
Thank
It's
you all.
very information.